Nirmatrelvir in combination with ritonavir is an antiviral treatment for mild to moderate coronavirus disease 2019, COVID-19. The efficacy of this treatment in patients who are at standard risk for severe COVID-19 or who are fully vaccinated and have at least one risk factor for severe COVID-19 has not been established. In this phase 2-3 trial, we randomly assigned adults who had confirmed COVID-19 with symptom onset within the past 5 days in a 1:1 ratio to receive Nirmatrelvir-Ritonavir or placebo every 12 hours for 5 days. Patients who were fully vaccinated against COVID-19 and who had at least one risk factor for severe disease, as well as patients without such risk factors who had never been vaccinated against COVID-19 or had not been vaccinated within the previous year, were eligible for participation. Participants logged the presence and severity of pre-specified COVID-19 signs and symptoms daily from day 1 through day 28. The primary endpoint was the time to sustained alleviation of all targeted COVID-19 signs and symptoms. COVID-19-related hospitalization and death from any cause were also assessed through day 28. Research summary. Among the 12 of 96 participants who underwent randomization and were included in the full analysis population, 1288 received at least one dose of Nirmatrelvir-Ritonavir, 654 participants, or placebo, 634 participants, and had at least one post-baseline visit. The median time to sustained alleviation of all targeted signs and symptoms of COVID-19 was 12 days in the Nirmatrelvir-Ritonavir group and 13 days in the placebo group, p-note 60. 5 participants, 0.8%, in the Nirmatrelvir-Ritonavir group and 1.6%, in the placebo group were hospitalized for COVID-19 or died from any cause. Difference, 0.08 percentage points. 95% confidence interval, 2.0 to 0.4. The percentages of participants with adverse events were similar in the two groups, 25.8% with Nirmatrelvir-Ritonavir and 24.1% with placebo. In the Nirmatrelvir-Ritonavir group, the most commonly reported treatment-related adverse events were dysgeusia in 5.8% of the participants and diarrhea in 2.1%. The time to sustained alleviation of all signs and symptoms of COVID-19 did not differ significantly between participants who received Nirmatrelvir-Ritonavir and those who received placebo. Supported by Pfizer, Epic SR clinicaltrials.gov number NCT 501513.